7 of 100 pregnant women develop gestational diabetes, a form of diabetes that develops during pregnancy.
Most of the time, once diagnosed, this condition can be controlled and treated.
On today's show, we'll discuss the diagnosis and treatment for gestational diabetes with an expert in fetal medicine.
Health Talk is up next.
Hello, I am Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. Joining us to discuss gestational diabetes, a type of diabetes that can happen during pregnancy, is Dr. Dimitry Zilberman. Dr. Zilberman is a fetal maternal medicine expert with the Western Connecticut Health Network.
Dimitry, thanks for joining us.
Thank you, Andrea and Eric. Thank you for having me.
So gestational diabetes, it sort of defines itself. It occurs during pregnancy. Why does diabetes occur in non-otherwise diabetic women during pregnancy? I know there are a whole bunch of physiologic reasons that this happens.
Yes, the gestational diabetes develops during pregnancy because of placenta that secretes a number of endocrine molecules that alters patient's control of glucose metabolism, and the patient develops diabetes in a setting of pregnancy.
And this is important. Why?
It's extremely important. As you mentioned before, it affects about 7 out of 100 pregnancies. It has consequences to the baby and to the mom. For example, women who have gestational diabetes, they have higher risk of having stillbirth, higher risk of having babies with macrosomia. This is where the baby is born large, and certainly having increased risk of having cesarean delivery.
So part of what do you do then to prevent this? Is this something that people are predisposed to, or can they do things to reduce their chances of gestational diabetes?
Well, some patients are at risk for it because of their history. For example, women who had diabetes in a prior pregnancy at high risk, women who carry multi-fetal gestation, family history of having diabetes, certainly increased risk, but also things like gaining excessive weight during the pregnancy. These are some of the risk factors for gestational diabetes.
What about if a woman is overweight going into the pregnancy? Is that a risk factor?
That certainly is a risk factor. Women who are overweight or obese certainly at a risk of diabetes during the pregnancy.
And how about age? Does age play a role in it's so bad to be old for almost everything else. Is the older mother at any greater risk for gestational
certainly
diabetes?
diabetes is not an exception. Women who are older are certainly at increased risk for diabetes as well.
So this is why the obstetrician tells people to eat a careful diet and only gain so much weight?
That's correct. That's part of every pregnancy care, is discussion with the patient about what is the optimal weight gain during the pregnancy, which differs based on patient's body mass index.
And we have a graphic for this that we'd like to bring up. And so take us through this, if you would, Dimitry.
So this graph shows us what is the recommended weight gain for women who are underweight, both normal weight and also overweight during the pregnancy. That's for singleton gestation, and for women who carry multiple pregnancy with twins, certainly the weight gain recommendations is increased. If you could show us the next slide.
Yeah, Dimitri, before we leave this slide, just the normal there would be the 18.5 to 24.9.
So normal,
that's the normal
body mass index is between 18.5 and 24.9, and the recommended weight during the pregnancy, this is the entire pregnancy, is 25 to 35 pounds.
Okay.
And then the next slide will show recommended weight gain if women are carrying more than one fetus.
Well, there are no recommendations for triplets and higher order multiple, but for twins we do have some guidelines or recommendations. So for women who are normal weight with body mass index before the pregnancy between 18.5 and 24.9, the recommended weight gain during the entire pregnancy with twin gestation is between 37 and 54 pounds.
Do you find, especially with single pregnancies, are women expecting that amount of weight gain, or is it lower than some women expected to be gaining during a pregnancy?
Well, some patients don't understand what the expectations are, so it's very important to go over these expectations. And some patients who have family members who might have gained 40 to 50 pounds, we certainly want to make sure that they have expectations, what is normal. And we want to make sure that they're aware of that from the beginning of pregnancy so they can watch the weight and watch their diet and also watch the exercise activity. Make sure they don't go over the recommended weight gain.
And again, it's for more than just about the weight itself. It's because increased weight gain puts women at risk to develop diabetes and other complications.
Certainly.
Which then puts their baby at risk. So it's,
Yes.
it's really...
It both puts the mom at risk and
Yeah.
also puts the baby at risk.
So how do you make the diagnosis of gestational diabetes?
So diabetes, gestational diabetes diagnosis is made based on a glucose challenge test, and this is usually done between 24 and 28 weeks, where we give patient a 50-gram glucose load and we check the glucose level.
And this by mouth.
By mouth, it's a solution that the patient drink, and then you check the glucose level in the maternal blood. If it's over 140 to 130 to 140, then patients go on to have a second test. It's a two-step approach we use in the United States, where we measure patient's fasting glucose level, then we give the patient 100-gram glucose load, and then we check glucose level at 1, 2, and 3 hours after that. And if patient has 2 abnormal values on a 3-hour glucose tolerance test, then patient is diagnosed with gestational diabetes.
So if you make the diagnosis, what do you do about it?
Well, the cornerstone of therapy for diabetes is exercise and diet. Okay, we certainly want patients to intake appropriate amount of calories based on, once again, on body mass index.
So you don't tell the patient to lose weight.
No, we certainly don't want patients to lose weight. What we want patients to do is take adequate nutrition to support their own health, but also to support the baby.
And I think we have a graphic of that too, that we can bring up. That will,
Yes.
We'll talk a little bit about the recommended calories for patients who, this is for all patients or patients with gestational
So
diabetes?
this is just for patients with gestational diabetes. So for patients with normal weight, we usually recommend 30 kilocalories per kilogram per day. So that turns out to be between 1,800 kilocalories to about 2,400 kilocalories. Certainly if patients are overweight.
And also, you're using the accurate term there.
Right.
What people use call calories, you're calling
Right.
kilocalories.
That's
the same
correct.
thing.
Yes. So then the patient needs to understand how many, what should be dietary requirements so they don't go over and certainly not go under and starve themselves. We certainly don't want that.
And we have a graphic also of how to distribute those calories between carbohydrates and protein and fat, and that's up now.
That's correct. Well, one of the most important factors not only to have calorie determination, but also how do you distribute that to include healthy foods. Most of the calories should be coming from carbohydrates, about 50%, and the remainder should be coming from both proteins and fats.
What about how women eat when they're pregnant across the day to manage gestational diabetes? Do you recommend smaller, more frequent meals, larger meals?
So we recommend usually to have 3 major meals, breakfast, lunch, and dinner, and have smaller snacks. And during those meals, half of the calories should be coming from carbohydrates, preferably complex carbohydrates, natural foods, non-processed foods, and the rest of the calories should be coming from protein and fats.
So with the calorie restriction, does that successfully treat most patients, or do you have to move on to
So a
other
significant
things?
number of patients can be successfully treated with just dietary restrictions and exercise.
Exercise really important.
Yes.
What if they do need medications?
So some patients are unable to control their glucose with just diet and exercise. Every patient who has gestational diabetes, we ask them to monitor the glucose levels 4 times per day, a fasting glucose level, and then 1 hour after breakfast, lunch, and dinner. And then if patients are unable to maintain normal glucose levels, the normal glucose levels for fasting is less than 90 to 95, and 1 hour after meals should be under 140. If patient cannot maintain normal glucose levels with just diet and exercise, then those patients would need to be on medications to manage the diabetes.
Now, I know there are tons now of new diabetes medicine. It seems like all of them are being advertised on television. Are those the medicines we're talking about, or are we talking about insulin?
So most patients cannot take some of the newer class of medications. The gold standard therapy for gestational diabetes is certainly insulin. With insulin, we are able to control vast majority of patients. However, in the last few decades, we have determined that there are other oral agents that can be utilized for diabetes. So we utilize two agents. One is glyburide. It's a sulfonylurea drug that has very long track record and has been evaluated in pregnancy. And also metformin can be utilized during the pregnancy.
And those are two older and, as I said, very standard drugs.
These are common drugs that have been shown to be successfully utilized for diabetes, both in pregnancy and out of pregnancy. But in the last few decades, we have good data to support its use during the pregnancy and safety.
We only have about a minute left. What happens after a woman gives birth? Do all these women who have gestational diabetes go on to have permanent diabetes?
So most women do not develop permanent diabetes if they have gestational diabetes, but they are at high risk for having diabetes lifelong, which may be as high as 50%. So we encourage patients to maintain diet, exercise, and control their weight after the birth of the baby.
So this is an important communication between the primary care physician and the obstetrician as well.
Yes.
Because 50% lifetime risk is a
yes. And we certainly recommend testing patients for gestational diabetes about a month and a half after the birth. Make sure they don't retain the diabetes after the birth of the baby.
And even if they don't, going forward, they remain at a higher risk of having diabetes.
Absolutely. Women who have diabetes during the pregnancy, they certainly have very high risk of developing diabetes lifelong. So they should maintain those healthy lifestyles that they acquired during the pregnancy.
And then if once a woman's had gestational diabetes, her risk of gestational diabetes with subsequent pregnancies is elevated as well.
Her risk is probably at least 50% with a subsequent pregnancy.
So knowing that going into becoming pregnant can be very important.
Absolutely. So before next pregnancy, we recommend the patient maintain the weight or lose the weight, be as close as to optimal weight, make sure they have good diet in order to decrease the risk of diabetes in a subsequent pregnancy.
I've heard about a lot of large babies lately,
Yes.
9 pounds or more. How often is that a signal of a problem with glucose handling or just gestational diabetes? And how much of that is just sort of normal variation?
So certainly women who have gestational diabetes are at risk of having large babies, 9, 10 pounds or even larger. But a large baby is also associated not only with diabetes, but actually excessive weight gain during the pregnancy.
Oh, okay, I didn't know
Very
that.
important. Well, unfortunately, we've run out of time. We'd like to thank you so much for all the
Yeah,
important
very
information
important
about
information.
gestational diabetes.
Thank you for having me.
We want to thank our very informative guest, Dr. Dimitry Zilberman, for joining us on Health Talk.
Please do send us your questions and comments about Health Talk to healthtalk@wchn.org.
Thanks so much for watching.
Be well.